In this video, I'm going to discuss about how to navigate into an episode and how to view the activities that we are doing in an inpatient episode in an organization, and what are the connections you have from the inpatient episode interface. Basically, an overview of the inpatient interface. So I'll go to sample patient now. So I'll give you an overview of the episode interface. And then let's say I'm going into this patient, Hobbit, and I'm going into inpatient episode. This one, which has been already finalized. So you can see basic information of the episode, including the consultant name, ward, and what's the department, and then what's the discharge date, admission date, and length of stay, etc. And what's the main complaint, what's the primary diagnosis, and what are the secondary diagnosis, and then comorbidities, past medical history. These are coming from uh, our original, where the patient health information is stored. So if you click one of these and if you want to go there and edit, click this view edit button. So you are going back to this interface, and you can edit information here, and you can come back using this button here. So you are going back again, and then um, uh, and yeah, so you can navigate into different information of the patient profile. um, and then we have other activity related information of the episode. Now these are procedures which are done in the episode. Now this is a cholecystectomy, and this information actually it comes from a template which I'm going to discuss later with a different from a different module. And this information which is about the procedure, it comes here. So as a summary, which will be really handy. And then you can add any procedure here as well. Now let's say if you want to edit something here, you can go edit uh, test. Let's say you will put your name here. You can go now. This is complainant's procedural terminology list is selected here. So I say herniatomy, herniatomy. Okay, foreign body removal. We'll put that one. Update. So this is updated. So this is actually kept in the episode, but this is not coming from a template like this. So this will be further discussed as we go ahead. But anyway, you can capture that information here. And events. Now events like special kind of activities which has happened. Now this is sort of a test event which I done. But let's say if patient had a febrile episode or a med call, etc. So that will come here. And then assessment data. Now let's say a risk assessment. Now let's say patient has been assessed through a FRAT. It comes here to this. Now this shows the scores and assessment scores and etc. This is another one. These are done by different tools we have in our episode, like this assessment pathways, risk assessment. We'll go into one by one of these as we go ahead. um, but basically this is like a summary for everything. And then staff discussions if you had, and referrals, um, like this is again coming from the cifra referrals, creating interface, and what's the referral then done. And then checklists, whether the patient had a, now let's say admission checklist is one of the checklist that you are doing normally in once patients are admitted. And then and care plans, and that kind of information, what sort of care plans used. We'll have a different module around care plan, and basically this is sort of like the uh, core main component of eCare pathways, using care plans for problems and addressing problems with tasks. Then we have observations, so we can go into details of the observation. Let's say now we have bubble charts here. We have charts, as well as we have uh, uh, observation tools. let's say vital observations. You can see what's the last value which is inserted there in the vital observation. If you want to go into the observation in more detail, you can select this one. This then you will be directed into the observation. Now this is the observation panel for vitals, and yeah, so you can navigate. Let's say you want to go back to the inpatient interface, just click here. So you are going back to the interface that you were here. So it's like a landing page in the inpatient episode or inpatient consultation episode, which you can navigate into other areas. Um, this is the inpatient episode interface, and then we have other three other few pages here. One, of course, I'll come back to these facts for discharge summary, but problem list is the other one we need to discuss as we go ahead. Now, you can see what are the problems patient had during this episode and what sort of task around that. Now, let's say false risk, which has been addressed, which has been identified, and there are other tasks around false, which somebody has set. So these are, you can set like free text, putting tasks with a timeline. You can set as a responsible person. But if you have already uh, predefined potential problems and task around that, you can auto generate auto and automatically, you can keep them. You can copy these to your patient profile from already available care pathways. Then it's very easy for you to make sure that your all the tick boxes are ticked for patient before patient is discharged. And so we'll discuss more on how to set the problem list, tasks, and responsibilities around that, and even how to set alerts if there are bottlenecks as we go ahead. Um, then we have clinical task lists, which these are like a set of tasks for this patient, which should be added very soon. Still under construction that area, but I'm going to discuss about this facts for discharge summary. It's like once you are going into progress, putting progress notes and doing patient activities, you can just put something that you need to keep as like a short note for patient in case if patient is if the patient is discharged, in case if you need to add this information to the discharge summary, uh, things like that. So it's like a small test kind of small text which you can keep and include later on. Let's say something like, now let's say I'm going to put add note regarding uh, electrolyte check after discharge, something like that is save now. So this will be there, and then finally, at the end of the once you're doing your discharge summaries, automated discharge summaries, this would be auto populated. Um, so these are the main things I want to discuss in this episode of interface, patient interface. And more details will be covered as we go ahead, mainly touching these areas. So you can go into different modules using these buttons. There are a number of modules around inpatient care, which would cover most of the activities which you are doing for patients in your organization. Thank you very much.